Don't stop. Don't stop. Don't stop. Don't stop. Don't.
Lymphoma Part 1. This part include 1. Risk factors of lymphoma, 2. Signs and symptoms of lymphoma, 3. Diagnosis of lymphoma, 4. General classification of lymphoma. Lymphoma is a group of blood cancers that develop from lymphocytes, a type of white blood cell. The name often refers to just the cancerous versions rather than all such tumors. Lymphoma versus leukemia. Both leukemia and lymphoma are types of blood cancer, and they do share some common symptoms. However, their origins, treatments, and specific symptoms set the two types of cancer apart. 1-1 Risk factors for Hodgkin lymphoma include infection with Epstein, Barr virus and a history of the disease in the family. 2 Risk factors for common types of non-Hodgkin lymphomas include A. Autoimmune diseases, B. HIV/AIDS, C. Infection with human T lymphotropic virus, D. Immunosuppressant medications, E. Some pesticides. F. Eating large amounts of red meat and tobacco smoking may also increase the risk. 2 Signs and symptoms. 1 Lymphadenopathy or swelling of lymph nodes is the primary presentation in lymphoma. 2 Symptoms. Systemic symptoms can be associated with both Hodgkin lymphoma and non-Hodgkin lymphoma. They consist of fever, night sweats, weight loss. Other symptoms: loss of appetite or anorexia, fatigue, respiratory distress or dyspnea, itching. 3 Diagnosis. 1 Lymphoma may appear as peritoneal lymphomatosis, as can be seen on CT scan. 2 Hepatosplenomegaly with liver metastasis, white arrows. 3 Lymphoma is definitively diagnosed by a lymph node biopsy, meaning a partial or total excision of a lymph node examined under the microscope. 4 Immunophenotyping. 5 Flow cytometry. 6 Fluorescence in situ hybridization testing. 5 Colonoscopy. In this procedure, your doctor looks at the inside of your colon by inserting a thin, lighted tube into your rectum. You're not awake for this test, so you don't feel any pain. The colon, also called the large intestine, is a common place for mantle cell lymphoma to spread. These tests not only help to diagnose mantle cell lymphoma, they also allow doctors to stage the cancer. Staging determines how far the cancer has spread and how fast it is growing. Lymphomas in the strict sense are any neoplasms of the lymphatic tissues, lympho plus oma. The main classes are malignant neoplasms, that is, cancers, of the lymphocytes, a type of white blood cell that belongs to both the lymph and the blood and pervades both. Several classification systems have existed for lymphoma, which use histological and other findings to divide lymphoma into different categories. The classification of a lymphoma can affect treatment and prognosis. Classification systems generally classify lymphoma according to whether or not it is a Hodgkin lymphoma, whether the cell that is replicating is a T cell or B cell, the site from which the cell arises. Lymphoma can also spread to the central nervous system, often around the brain in the meninges, known as lymphomatous meningitis, LM. 1 Hodgkin lymphoma. Hodgkin lymphoma accounts for about 15% of lymphomas. It differs from other forms of lymphoma in its prognosis and several pathological characteristics. A division into Hodgkin and non-Hodgkin lymphomas is used in several of the older classification systems. A Hodgkin lymphoma is marked by the presence of a type of cell called the Reed-Sternberg cell. Non-Hodgkin lymphomas, non-Hodgkin lymphomas, which are defined as being all lymphomas except Hodgkin lymphoma, are more common than Hodgkin lymphoma. A wide variety of lymphomas are in this class, and the causes, the types of cells involved, and the prognosis vary by type. The number of cases per year of non-Hodgkin lymphoma increases with age. It is further divided into several subtypes. 3 Epstein-Barr virus-associated lymphoproliferative diseases. Epstein-Barr virus-associated lymphoproliferative diseases are a group of benign, premalignant, and malignant diseases of lymphoid cells, i.e. B cells, T cells, NK cells, and histiocytic dendritic cells in which one or more of these cell types is infected with the Epstein-Barr virus, EBV. The virus may be responsible for the development and/or progression of these diseases. In addition to EBV-positive Hodgkin lymphomas, the World Health Organization, 2016, includes the following lymphomas, when associated with EBV infection, in this group of diseases: 1. Burkitt lymphoma. 2. Large B-cell lymphoma, not otherwise specified. 3. Diffuse large B-cell lymphoma associated with chronic inflammation. 4. Fibrin-associated diffuse large cell lymphoma. 5. Primary effusion lymphoma. 6. Plasmablastic lymphoma. 7. Extranodal NK/T cell lymphoma, nasal type. 8. Peripheral T cell lymphoma, not otherwise specified. 9. Angioimmunoblastic T cell lymphoma. 10. Follicular T cell lymphoma. 11. Systemic T cell lymphoma of childhood.